Today we're going to talk about retinal vein occlusions, new treatments, as well as what happens in retinal vein occlusions. My name is Usman Said. I'm a consultant ophthalmologist at the Royal Liverpool University Hospital. There are quite a few reasons why you can lose vision in old age. One of them is cataracts. Other ones are glaucoma, macular degeneration, retinal vein occlusions, and diabetic retinopathy. With retinal vein occlusions, you can lose vision suddenly. Usually there are underlying vascular risk factors, which mean that you might have undiagnosed blood pressure, undertreated diabetes or not treated diabetes, high cholesterol, blood problems, clotting issues, or hematological problems. Sometimes you can get a central retinal vein occlusion, which happens and causes more damage with a poorer prognosis. Branch retinal vein occlusion usually causes less damage and has a better prognosis. There are lots of tests we can do to find out what the extent of the damage is. One of them is called OCT, which can detect the degree of macular edema. Another one is called a fundus fluorescein angiogram, which can show the extent of ischemia or vascular blood flow and therefore can guide treatment options. One of the treatment options would be to try and reduce the blood from clotting in the first place, and we normally suggest aspirin or Plavix or clopidogrel or warfarin if you do have an abnormality with the blood clotting. I would suggest that blood pressure is treated aggressively along with diabetes, cholesterol, and you need to go to your GP to look for blood disorders. If the blood flow is compromised, the prognosis is usually poorer. So if you've got an ischemic retinal vein occlusion like this one, you can see there's a lot of blood in the retina at the back of the eye. And when we see there's a lot of edema or swelling in the retina at the central part of the eye as well. And that's what both of those together are poor prognostic indicators, which means that the site is likely to be severely affected and treatments are likely to be less effective. We can treat retinal vein occlusions with laser treatments for branch retinal vein occlusions and macular edema. We can give intravitreal anti-VEGF injections for retinal vein occlusions with macular edema and Ozurdex implants for branch retinal vein occlusions or central retinal vein occlusions with macular edema. If we have an ischemic retinal vein occlusion with rubeosis, we do offer PRP retinal laser, but the aim for that kind of treatment is just to keep the eye comfortable and usually doesn't result in improvement in vision. Quick summary of retinal vein occlusions and what retinal vein occlusions can do to a person's vision. If there are any questions, don't hesitate to ask.